Hello and welcome back. Today we'll be talking a little bit about health policy. Now before we do, I just want to say a few words about how the public thinks about public health. So what is the context in which we're working when we're making and deciding policies? Well, there's some good news here actually. The American public, generally speaking, actually thinks that the majority of Americans actually benefit from public health efforts. So people tend to be pretty enthusiastic about what public health can do and what it can bring. Now, in terms of how they view it, there's also support for us giving more attention and more resources to public health. For example, about 75% of the population says that we're spending too little on improving and protecting the nation's health. So taking care of those public health background needs to ensure that we're protecting health of the public. Also, when you look at how people view public health, there's a lot of support for efforts that prevent disease as opposed to medical care where you treat people who are already sick. So people understand that if we can prevent diseases before they occur, that's actually a really positive approach to doing things, rather than waiting until people are ill. However, when you actually look at how people view the existing public health system, although there's some indications that people think that it's pretty good, there's also a fair number of people in the public who think that, we need much more work on our systems for protecting people from health threats, that the CDC could have additional support and do better, and that local public health agencies could do better. So there's room for improvement here, and people recognize that. Now, as I mentioned, for context for this previously, part of the issue here is that public health is invisible, right? So it's very hard to argue for funding, to argue for support. Remember, less than 5% of our actual national funding goes to public health and prevention as opposed to the medical care, right? So it's public health, when it's working well, you don't see it, right? So this is part of the national dialogue about how we think about and approach public health policy. All right. So what is public health policy? So as Riegelman discusses, public health policy is really thinking about the idea of what we're doing as a society to make decisions or make plans and systems of approaches for dealing with health-related issues. Now, there's law, which is a little bit more focused on policies that are enforced by the government. So there's ways of actually making people do those things. And then public policy is a broader understanding, which includes laws, but it also includes things like everything from small decisions in local areas. For example, a policy here on campus might be something like we can't smoke within a certain distance of the doors, or policies about expectations of how we handle students who appear to be having mental health challenges in class, or things like that. So there are things that we can do at a very small micro level that is public health policy. Then you have everything up to huge governmental policies, like policies related to health insurance or things like that. So the idea of public health policy spans a huge range, and there's many different ways that people can engage with that policy. And hopefully as you go forward in your education here, you'll have some chances to be involved in that in some way or another. All right. So one thing I want to mention about policies is sort of often a misconception about how policy occurs. In an ideal world, we would have policies which actually are based upon knowledge about what the situation is, so that we will have the best policy possible and people will therefore benefit by it. And that's the idea of really research-based approaches to doing things. Now, the truth is that when you look at policy happens in a wide range of different ways. And I'm going to call them evidentiary ways and extemporaneous ways, right? So evidentiary ways are ways that we actually think policy happens, which is that we gather lots of data about a health-related issue, and then we think about what are the ethical considerations and concerns, and we engage the public and talk about what they need and want from health policies. All right. Then there's the extemporaneous approach, which is essentially policies get decided based upon political pressure. So it can be advocacy from specific groups or from companies, commercial entities, or it could be certain legal requirements that just require that you do things a certain way, regardless of whether it's even really the best way to do things. Or certain professional groups might argue that we need to do this because, it will advance that particular profession. So these extemporaneous approaches aren't necessarily based upon evidence or careful consideration about how things should go forward. So I'll give you an example of this. In my own field, one of the major public health things that we do is newborn screening. And there's a story about essentially a coach for the Buffalo Bills in New York State had a relative who had a rare genetic disorder. And he was really unhappy about that. Understandably, I mean, you would be upset. So he called up the governor of New York State, and within I think a matter of days or weeks, they'd suddenly changed state law so that on that newborn screening test that everybody gets, this disease was covered. All right, so everybody not only was that an option, people were actually now required to take that newborn screening test right across the entire state. So whether or not that's a good thing is debatable. But the point here is that the decision about whether or not to make that a new law and a new policy for the state wasn't really based upon any sort of gathering of evidence about whether this is a positive thing or not, what the cost-benefit ratios were, anything like that. Is really this person wanted it, they talked to someone in power, it happened. Okay. So that is how policy can happen. And we really want to think about how do we ensure that health policy is based upon what is best for the public, based upon our best knowledge about evidence, about the ethical factors related to this, and how the public views and wants this to be applied. So here's sort of a schema for a general public policy sort of change. All right. So we start down in the corner here where we talk about the problem definition and agenda setting. So when we're thinking about a problem, you want to figure out what that problem is that we want to address. Now, once you have that idea of what this problem is, then you want to start consulting, engaging with different people to understand how people think about it and gather information about it. So one major way to do that is involving stakeholders. And we'll talk about who stakeholders are a lot later. But the idea here is that you want to engage with people who care about that public health policy issue. So when you start engaging with people, you're going to start being able to come up with new ideas about how to address that problem. So you can start coming up with different ideas about different approaches to deal with it. Once you come up with those ideas, you can hold public hearings. You can, based upon that information and the evidence that's available, you can actually start making some decisions about how to move forward with that policy, and then ultimately implement that policy in practice. Now, any policy, you should actually be monitoring it over time, right? You don't want to create a policy and just have it sit there, because most policies aren't perfect. That's the reality, making these plans, the best laid plans, when they meet the real world, are often, have real challenges to them. So, as a public servant of integrity, you want to actually be monitoring it and adjusting those policies as needed. And sometimes that will actually require you to redesignate, change up that policy, and maybe come back to the drawing board and come up with a new problem and define a new problem and go through that whole process again. So the idea here being that it is a cyclical process that you're working on. Now, how does that happen in terms of the public health structure? So we'll talk a little bit about the different components of the public health system at a later point. But there are a lot of different groups that you engage in this process to make it actually happen. So some policies happen at the community level. So community and private organizations. Every hospital nearby has all sorts of different policies about how you treat certain things, how you coordinate care, how you do different things in terms of taking people, as do each even the university or other things, other organizations like that have important policies. All right. Then as you go up the levels, we have local health departments that have policies. Just up the way, Snohomish Health District or King County, Seattle Public Health. Right. So these organizations actually do think about these things, create policies that support and protect our local regional population. But then we have overarching bodies at the state level, and then that goes out to the federal level. And then we also have organizations that function at the global level. So there's all these different public health organizations that think about policies related to health. But then there's also the other government agencies that are really important as well. So the EPA, even economic decisions make a huge difference on health, education decisions. So there's a lot of different organizations as well that interact with these types of policy decisions at a larger level. And then we have the healthcare delivery system, which has a huge role in this. So this could be at the individual, the smaller level in terms of individual hospitals, but then there's a lot of structures in place for determining how the medical system interacts and how insurance covers people and things like that. So all these things together create some of the landscape of how health policies are created. All right. So something that isn't really in your readings is work that some ideas that I want you to be aware of when we think about public health policy. All right. This is going from the idea of what public health policy is to how you actually do public health policy. And I want you going forward in your career to really actually have a solid handle on how do you engage with that policy. So here's some ideas about how to do this, which were originally put together by Dr. Locke at Johns Hopkins. All right. So the first, there's some steps here that I'm going to go through, and we're going to go through them one at a time. But first, the idea here is developing a strategy. So how do you actually go forward and create a plan for dealing with this problem that you're addressing as an advocate to try and improve health, right? Then you want to think about developing a message. How do you put together a communication plan to get people to do what you want them to do in public health policy? Then you want to actually communicate effectively to get people on board. A major component to this is knowing who your stakeholders are, who are your friends and foes in this process, so that you can be thoughtful and careful as you move forward with approaching this. And then, ultimately there's going to be the political compromise of deciding, are you getting enough of what you want in this approach? So that's where it comes down to making a decision about whether you can go forward with a plan or not, or whether you want to walk away. All right. So in terms of strategy, here's where you're really trying to figure out what you want to accomplish with what you're approaching here. So having a good idea, clear idea of this before you start is actually a good idea, because you need to know what you want before you start asking other people to get on board with this and help move it forward. So once you have some idea of what you're trying to pursue and fairly clear objectives to your project, you want to start thinking about, okay, how long is this going to take? What is the timeline for moving forward with this? What resources do you need? Are you going to need money? Are you going to need certain political connections, other things like that? And then how will you actually measure whether or not you're succeeding in moving forward with changing this policy? So there's a few things that you would also do as once you have your plan, to start developing a way of communicating with people to deliver your message to them. So one, you need to think about what evidence is there. Again, we want our public policy to be evidence-based as much as possible. So you want to take that evidence and think about how can you explain that in a clear way to convince people to take it seriously. So you want your approach to be, your message to be strong. You want it to be clear and concise so that people can simply understand it, and for it to be also credible so that people trust what you're saying. Within this, you're going to have to prioritize different elements of this message, and focus in so that people aren't overwhelmed with the amount of information that you're providing. You also want to include clear suggestions for what people can do to move forward with this, to actually take this and run with it. Because if you just tell people things but you don't tell them how to use it, well, that doesn't help anyone too much. And the other thing that's really important here is to be honest. It's really tempting when you really want something to happen to kind of cut corners and maybe, not be entirely transparent. But ultimately, it's really important to be honest with people. And it's my belief that in the long run, that will serve your interests. So trying to do justice to things, to actually clearly and meaningfully engage with the topic so that you recognize so that people can make good decisions about this, essentially. So there's a few things that you also want to think about as you're developing this message in terms of how you actually are going to convey this information to people. So you want to choose the right person to actually talk about this. So in doing so, you want to think about who you're talking to. Who's your target population? There's different populations that are going to take different people more or less seriously. So if I were trying to advocate for a change in policy at a hospital, I might not be the best person to go and talk about that policy. It might be better to talk to a colleague who's a nurse, who's actually a clinician, who has that experience and can talk to other healthcare providers in a practical way that I, as someone who isn't trained as a clinician, probably can't connect, right? So figure out who's best to do that, right? The other thing is thinking about framing this communication. So how can you set it up so that you're the good guy, right? How can you set yourself up so that people see you as a positive influence on the situation instead of being someone saying, hey, you got to do this is bad, blah, 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 right? So that requires some thinking, in terms of setting this up. Another factor is you want to be consistent. So you want your message to sort of stay on track. You don't want to be saying one thing, then another thing, and have that sort of back and forth, because people will have trouble sort of following your chain in terms of where you're going with things. And what's really important is before you actually start with this communication campaign to actually get people to do what you want to plan for the counter arguments, right? So you want to think about what are people likely to say that they might disagree with you on, right? You also might want to think about social and moral values that might oppose what you're doing. There's certain things around health that as we've talked about before, really have a major social and ethical component to it. And people, you got to respect that people are just going to view things differently, right? And if you go into that communication, into that conversation without really thinking about those things, you're going to not be able to address them. And being able to address them and be honest and careful in that communication really requires thinking about it beforehand. All right. So that's an important element to effective advocacy. All right. So here's where I start to get into what I call stakeholder analysis. And I think that this component to things is one of the most helpful things I've ever learned about public health policy in terms of practically getting things done and helping people. So I'm sharing it with you because I think it's really tremendously important for just being practical in terms of addressing public health policy, but really any sort of change, anything that you're trying to change in social structures, in policy, in anything at all, as an activist or as a advocate of any sort, this is something that you should really be paying attention to. All right. So let me start off by saying a little bit about what stakeholders are. So stakeholders are really people who care about the issue that you're trying to engage in. They're anyone who has sort of a legitimate interest, who has personal connection to that, and would benefit or lose based upon how this moves forward. All right. So these are the people who are your stakeholders. Stakeholders are going to vary, and they're going to vary in terms of how important they are depending on what type of thing you're working on. But common ones are things like government agencies, they could be professional organizations, nursing organizations, medical organizations, labor unions, researchers, the general public. So there's a whole range of different groups that you could think about in terms of engaging with when you're looking at making a policy change. So you can look through that list and think a little bit about, okay, who am I considering and who did I not think of when I started addressing this issue? Right. So a way of thinking about this is to consider how your stakeholders can actually influence that policy. So some stakeholders are really important for pushing for changes in laws or regulations or other policies that are important. These stakeholders can play a major role in deciding or pushing for different resources, ensuring that the policy change is actually funded, right? Some stakeholders are really important because they have a lot of pull in certain communities. So they could, have a lot of respect within a medical community and everybody really cares what they think about something, or they're really respected in the local community. They're a religious leader or some other leader of some sort, and people want to know what they think. They could be the people actually providing the services, or they could be people who are conducting research in that area, right? So they are experts in climate change or in how we design transportation systems or things like that to ensure that there's no accidents. So these can be people who are important. And they could also be people who make decisions about what are we going to buy? What are we not going to buy? How are we going to use the money that we have? So when you sit down and try and say, okay, who are my stakeholders for the thing that we're trying to do? There's a few different things that you'd think about. One is, okay, who already cares about this? Who have I already been talking to this about? Also, who are people who might actually make an influence on this decision? There's some people who might not be engaged in this conversation who actually are pretty influential that you really want to connect with. Also think carefully about who will win based upon whether or not this goes forward, and also who will lose, right? Those are the people who have some stake in this, right? who has knowledge or information about this, who has done it before. So sometimes when you move forward with policies, there's been people who've worked on those policies before who maybe they failed in previous attempts, or maybe they have succeeded part way, right? So you want to talk to those folks because they actually know a lot about what it's like to work on this project, all right? And then finally, who's going to be mad at you if they aren't included in this conversation? Some people actually don't really care one way or the other about how this goes forward, for whether or not this goes forward, but they care whether or not they're respected and considered in policy discussion. So who's going to be mad at you if you don't talk to them, right? So based upon those considerations, we also want to think about, okay, of those people, how do we take them and break them out in terms of how we treat different types of stakeholders. All right. So here's a 2x2 matrix that is helpful for thinking about your stakeholders. So if you're going to try and create a policy around smoking, or you're going to try and create a policy about creating access to food or any sort of change to public health policy or health policy, there's going to be a certain set of stakeholders. But very often that's going to be a large set of stakeholders. So you're going to have to go through a process of thinking about, okay, how am I going to engage and treat these different stakeholders? All right. So the way that you can do that is you can take your stakeholders and you can think about, okay, how interested, how much do these stakeholders care about this public health issue? And that's along the x-axis. And along the y-axis is how influential, how important are these stakeholders to this public health policy decision. Okay. So for people who, for individuals or groups who they don't really care about it, and they also don't have a lot of power or influence in whether or not this policy goes forward, well, those are groups that maybe you don't need to prioritize in terms of moving forward with this conversation. These might be people who you'll just, or groups that you'll just notify to let them know that you're working on this. But you might not need to engage them very much, right? Then you have some groups that might have a lot of interest in a policy change, but they might not be very powerful in certain systems. So this might be, for example, unfortunately, a lot of public interest groups that are, activist groups or something like that, they might have a lot of interest in a health-related policy change, but they might not have a lot of decision-making power, right? So those are groups that you can, show consideration for and respect and engage in that conversation. And they can potentially help you out in terms of moving this forward. Then you have people who don't really care, aren't very interested, but they actually have a lot of power in making a decision about whether or not we go forward with this policy. So those are folks that you want to engage with, try and increase their interest in it to get them moving to help your policy move forward, right? And move them into the main box. And the main box is for your key players, right? So your key players, that's the red box, is the folks who are both really important to whether or not this policy moves forward, and secondly, also really interested in this policy. So the key players are the ones that you really want to engage with a lot as you move forward and as you do this advocacy effort. So you want to engage them in terms of conversations. You want to pull them into perhaps your meetings where you make decisions about how you're going to word or decide this policy, what it's going to look like. And you're going to want to keep in touch with them as you move forward. Now, in looking at this graphic, again, you see the arrows showing that you may want to, in your efforts, you want to think about your stakeholders in terms of moving them to the side of being more interested, because as you can move them into more interested boxes, you can get them to help build momentum around moving forward with this policy. But again, you do want to prioritize those key players in moving forward. So there's going to be some triage where you're sort of making decisions about how you're going to play off and focus your efforts to get this policy rolling. And that's going to depend on the situation. There are certain policy decisions where really all you need is one person to make that decision. You have someone who's in charge of deciding that policy. And then that key player becomes really important. But there's other decisions that require many different groups to come together to together decide that we're going to move forward. And then you might have a more diffuse strategy. The other point that I really want to make about the stakeholder analysis is sometimes your key players are also people who don't agree with what you're doing, right? So you can have someone who's really interested in your policy, but they might be dead set against stopping that policy from happening, right? So remember that in this framework, you also want to know the people who really want to oppose you, who really don't want this to happen, right? And those are also people that you want to potentially want to engage with. All right. So another strategy, once you have these stakeholders and you've begun to characterize where they fall in terms of dealing with this, is to actually create a grid where you, for each of those stakeholders, you assess them based upon all these different characteristics. And this can be really helpful for designing a strategy for moving forward. All right. So the first question you'd ask is how important are they to this decision? And that's the y-axis in the previous chart. You also want to think about how supportive they are of it. Okay. So that's another component here. Then once you have that as a general framework, then you want to ask the question of, what do you want that stakeholder to do? Right? What are your hopes based upon where they are about what you want from them? So as you're thinking about designing a strategy, you want to know what you're actually hoping that they can do so you can articulate that to them clearly. As you're thinking about your communication campaign, you also want to know, what does that stakeholder care about? Your stakeholders could care about a huge range of different things. They could care about, does this make my job easier or does it make my job harder? They could care about legal approaches. So knowing what they're going to come to that conversation with and want for themselves is really important, because if you can't communicate to someone in a way that you can say, here's the thing that this is going to give to you, then you're not thinking about their interests too. People have their own interests and you want to be respectful of those interests. And, it's going to be a lot harder to get them on board if you can't talk to them about what they want, right? Then you also want to clearly think about, how could that stakeholder block you, right? So if that stakeholder says, I'm not going to get on board with this. I don't want it because it's going to make my job harder, or, it violates one of my beliefs about something. Well, you want to know what things they could do to make sure that your thing doesn't move forward, right? And then finally, based upon all that information, you can then come up with a strategy for how you're going to communicate with that stakeholder to try and enhance their support and to move forward with making this policy change happen. Okay. So when you think about all these different factors, you can see why I'm teaching you this, right? These are kind of the components that you can use to strategically think about an issue and actually make it happen, right? There's no solution that will always mean that you always get what you want, right? But if you go through it carefully and you come into a conversation with a strategic plan, your likelihood of actually getting that to happen just skyrockets, right? There's so many policy changes, so many efforts that just get scuttled before they even start. Things that could really help people just because people make mistakes and they make the wrong person mad, or they don't engage with the right people, right? And they don't gather the information they need before going forward, right? And if you take these strategic steps, you're a major step ahead towards actually getting what you're hoping to do to improve public health. So the truth is that we have all these strategies for doing things. Sometimes it doesn't always work out exactly the way you hoped, all right? So sometimes you get part of what you want, and sometimes you don't get what you want at all, right? And when you go forward with a policy and it's not entirely what you're hoping for, you have to make some choices. So sometimes your choice will be, you know what, this is not enough of what I'm hoping for that I actually think we should go forward with this. I'd rather walk away and come back later and work on it more in the future when hopefully I have a better chance of getting this done because of changes to like political situations or having additional resources or information that make your argument stronger. Or you might say, you know what? This is not exactly what I want, but it's close enough. And that can also be a choice. So there is that when the rubber meets the road, you as someone advocating for something, are going to have to make some decisions about whether or not things are good enough. And hopefully, if you've taken the steps that we've talked about to strategically approach this, you will be in much better position to make that choice and hopefully to actually get what you want. So that's about it. Thank you for listening, and we'll talk about this more in the future. So take care.